Thank you for joining us for Couch and Court Issues. My name is Carla, and I'm a therapist. And I'm here with Mark, my husband, and family law attorney, and our special guest and friend, psychologist Dr. Jill Jeffers Clark. We're excited about being here, and we're glad you joined us for Couch and Court Issues, where we talk about real-life problems that impact the family.
Hello, today we're going to talk about mental health issues and the impact it has on the family with our special guest, Dr. Jill Clark. Jill, will you share a little bit about yourself?
Yes, I'm a licensed psychologist, and I have a private practice in East Sacramento called Restoring Family Harmony.
All right, thanks very much. Let's jump right in here. First question we have is, why do people come into therapy?
Most people come into therapy in my office for relational problems. They may be family problems, problems with their spouse. They just are feeling pretty hopeless to find answers.
Right. And, I also think people come into therapy because they don't have the answer. They realize that they don't want to burden their families and friends. They've talked to them about this over and over, and they weren't able to get enough insight, or that they're still in pain, or that people are not really listening and hearing them. They're looking and seeking for solutions. There's some great reasons why people come into therapy, and I think it's great. And they're just trying to figure out, how can I move through life better than what I'm moving through and living through life right now? So for solutions, hopefully that's why people come to therapy, and they may have lost some hope.
Jill, you want to share anything else about why do people come into therapy?
Well, there's all kinds of reasons, such as maybe their children are having behavioral issues. Maybe it could be ADHD, depression. Maybe their marriage is headed in the wrong direction. Anxiety is the most frequent reason that people in the United States come to therapy. Depression, a traumatic event, things like that.
Okay. Well, what are some of the obstacles that people have when they come into therapy for both of you?
I like that question because we're talking about why people come into therapy, and sometimes we look at why people don't come into therapy. And I think there's more reasons why people don't come into therapy, and it ranges a huge area. I think, one of the concepts is the just get over it theory, that something is going on and you should just move on and move past it.
Yes, and they may not know how mental health works. Why would I go in? Why would I go to mental health therapy? And who would I go to? And who's going to pay for it? And do I have time? And is it okay with the people in my circle of influence? Do they think it's okay to go to therapy?
Right, because there's a lot of shame still when it comes to mental health and issues related to the brain and emotions. There's a lot of shame in that, and a lot of embarrassment to know that you need assistance. That's interesting because in other areas of life, there's not a lot of shame and embarrassment. If you have a heart problem, there's not a shame in saying, I need to go to the doctor and check out what's going on with my heart. But somehow when you have an issue concerning the brain, people have a problem thinking, I need to go where the experts are to figure out what's going on with me.
Yeah, that's right, Carla. I mean, when it comes to a mental health problem, it has to do with your thoughts and your feelings. And so people think, I can fix that myself. I should be able to fix that myself. Right. And truthfully, there's a lot of evidence-based practices strategies that we can teach people that really help and that they may not think about.
Right. And, I think you talking about strategies is a great idea because a lot of people who've never been to therapy think that you just sit there and talk and someone listens. Well, there's a lot of people in people's lives that can do that, friends, ministers, and not to downplay those people. We do more than just sit and listen. There are different strategies and techniques, and you can move people forward a lot faster in going there. And, another reason why I think people have obstacles coming to therapy is because we overuse this word normal in our society. People say, it's normal to be depressed, or it's normal to feel anxious, or it's normal. Well, I just want to break that because normal does not mean healthy. Just because normal is the norm. If everybody in your community is doing something negative, then that's negatively normal for everyone to do that. And that doesn't make it okay. That doesn't make it healthy. And it doesn't leave room for growth and change. Let's work on, is it healthy? Is it healthy that I'm feeling this way? Is it healthy that this is going on? And if not, let's go and seek health. Do that in the church, and we can do that in the community, and we can do that through prayer counseling. All of those things are great, and we can also do it through therapy.
Let's talk a little bit about what are your views on medication, because I know that's a controversial issue. Jill, why don't you start us with that?
I do not push medication on people. I find that Virtually every client who comes into my office has a misunderstanding about medication that they've learned from some byline in the media that doesn't cover research on medication appropriately. My view is when there is extreme circumstances of depression or ADHD, things like that, we try all of the other strategies, but medication can really change people's lives and help them function.
Right. And that being said, medication alone isn't the answer. So medication along with therapy is the solution. You know, I used to be a special ed teacher, and we had this big wave of everyone needs to be on medication. And it was this big fear that they're going to say my kid, I don't want to get tested because they're going to say that my kid need to be on medication. But that's a choice. And it's up to the medical profession and that person to make that choice. And I'm no way a medical professional, not close. But what I do know is I've seen it with my own experience in my own life that there are some kids that no matter what behavior techniques, what we do, wasn't enough, but a little medication along with training, consistency, structure, and some great techniques was a miracle. And for some of them, they slowly didn't need the medication. And for others, they may need the medication or adjustments in different medications. So my encouragement is don't rule out anything that may be healthy and helpful.
Jill, you want to add anything regarding the medication?
No, I think Carla did a very good job.
So do I. I think she did. Let's talk about why do people encourage others to take part in therapy?
Well, I think maybe they don't want to see their family or friends in emotional pain, or maybe they've been to therapy and they know how healing it can be.
Right. I think that's the biggest one. People who've done therapy are like, you need to go. They're encouraging others to go, and it gets rid of shame, and they know that there's solutions in therapy. Also, people don't know what to do. It's almost like saying, I have a friend who broke their arm. All I need to do is know either I'm going to call 911 or rush you to the ER. I can't help you. And so sometimes people come with us to their burdens, and I know I can pray for them. I do that. I can pray for them. I can listen to them, but I can't solve everything. And so going to a therapist is another tool to help solving and moving towards a solution. The Bible's another tool. All these are tools that God has given us to move forward in our lives. And I in no way want people to dismiss any of the tools that may be helpful. Education is a tool. Knowledge is a tool. And this is just another tool.
And God's gifted some of us, most of us psychologists and therapists, to really help others in their time of need. And a psychologist has a minimum of 7.5 years of training and practice in these special areas that most people don't understand what to do when they can't sleep because of anxious thoughts, or they can't eat because of being depressed, or they want to sleep all day. They don't really know what to do, but that's something that we do every day and we care greatly about.
Right. And being a quick fix society, some people say, I don't know what to do. Let me go take a sleeping pill. And like I said, I am not a medical professional, but there are so many other things that can be done first. And if you go to a psychologist or a therapist, they can help you work through those things after you go to your medical professional and make sure it's no medical reason that something is wrong.
We really can help people reach their potential.
So let me ask you then, we're really talking about the benefits of therapy. What, in essence, if a person's never been to therapy and it's something that they are looking at doing, what are the benefits, the short-term and long-term benefits of therapy?
That's a good question. There's lots of them. I mean, when people feel better and understand how to get over their worried or anxious thoughts, they can function better in society and they can meet their goals.
Right. You know, one of the biggest benefits I see is people don't know what's going on. They think they know. They think, I'm going to go to therapy. This is what's stopping me from moving forward. And once they get to therapy and they have an outside person looking into their lives with education, knowledge, and experience, what they think is a problem is really something else, and then that can be addressed. So that's one thing is for me is that's really important. I work with a lot of people who have drug and alcohol problems, and they don't even know it, or are addicted to prescribed medication, and they believe they're just taking it because they're in some type of physical pain. And once they get in the office, once they get good work done, they can realize that there's other things that's causing that to happen. And we can address those issues. And then in addressing those issues, we can first address their drug and alcohol problem. And then they can open up to what's really been going on, what's really was the source of those issues. So it's sometimes an outside source that's going on that's not even related to mental health. It could be related to drug and alcohol, and they're not even aware of it. Or some past episode that happened in their lives, and they don't even understand some resentments they're holding on to that is preventing them from moving forward in their life. So I think addressing all those issues from someone who's an outside provider who can look into their lives and see things for what it is a great reason.
Yes, having a therapeutic relationship with someone who's objective and understands the problem and how to help you get going in the path that you want to go really makes a difference. I've had some really great outcomes with, say, freshmen, sophomores in college who are partying too much, doing lots of things besides going to class, and I can work with the whole family around that and help them understand what might be going on, why the anxiety might be getting in the way of their reaching their capacity in college.
Right. And then we could go to solutions, which there are solutions and tools and techniques. And I just want people to know that, because when I listen to some people who are not knowledgeable about therapists, once again, they think it's these old movies where someone's laying on a couch and someone's just listening and shaking their head. And it's really not about that. It's really solution focused.
Let's talk about when a person does come to a therapist. I know the communications. Can you tell us a little bit how do the communications work? Are they privileged? What type of confidentiality? Jill, can you tell us about that?
Yes, all licensed therapists and clinical psychologists follow a code of ethics, which means that we are very careful about confidentiality and we keep things private.
You know, we also talk confidentiality. What about the time when a person comes to you in a crisis? Tell us a little bit about what a crisis is and how do you handle that as a therapist?
Well, a typical mental health crisis would be when a person is in imminent danger of doing harm to themselves, such as suicide, harm to others, such as homicide, and they're gravely disabled, which means they're not functioning and they can't take care of themselves due to a mental disorder.
A lot of people are aware of the term of 5150 or 72-hour hold. You know, and that allows a clinician to involuntarily confine a person deemed to have a mental disorder that makes them a danger to himself or others or gravely disabled. Also, a 5150 or 72-hour hold is a means by someone who's in a serious need of mental health treatment can be transported to a designated psychiatric inpatient facility for evaluation and treatment. And that's usually up to 72 hours.
If you just joined us, we have been talking about mental health issues, what we can do as a community to show support and encouragement and encourage individuals and families affected by mental illness. My name is Carla Ambrose, and I'm a therapist. And I'm here with my husband, Mark, who is a family law attorney. Couch and Court Issues arose from our desire to talk about topics that impacts the family from a therapist and legal perspective. Joining us today, I'm so excited about it, is my friend and therapist, psychologist, Dr. Jill Clark, who is a private therapist. Her practice is called Restoring Family Harmony.
Jill, we had talked a little bit about a crisis. You wanted to go add something to that.
Yeah, I wanted to follow up by saying that in my practice in East Sacramento, we don't tend to treat people who are chronically in crises. Now, I have a protocol in case someone is feeling suicidal or homicidal and the thoughts are so intense that we need to work with the family. We don't always send them to the hospital. It's a very rare occurrence in a typical private practice, but that's a legal hold, and so we just have to know about it.
Right. And truthfully, it's rare in most occasions, because in most occasions, people sometimes escalate or sound excited. We don't overreact to that. It's almost like saying, when do you call the ambulance? When do you send someone to the ER? When do you call 911? It's the same mentality when it comes to mental health services and therapy.
Yes,
so
many people who come into therapy have some mild to severe depression, and that almost always includes some thoughts of disappearing or feeling suicidal, but that doesn't make them 5150able.
Right. You know, with that, I think it's appropriate. I'm just thinking about the verse Matthew 11:28-30, which says, "Come to me, all you that are weary and are carrying heavy burdens, and I will give you rest. Take my yoke upon you and learn from me, for I am gentle and humble in heart, and you will find rest for your souls. For my yoke is easy and my burden is light."
Absolutely.
Definitely. We're talking about mental health. What role does the church have in therapy, Jill and Carla?
I think the church can have an awesome role if we choose to take it. And one of them is having insight and encouraging people to get help, encouraging people to join Bible studies, to talk to their pastor, to hear the word, to pray, and also to seek the services that they need. And mental health services sometimes are so underutilized because we sometimes in the Christian community don't believe we need that type of assistance. So I think we can, as a church community, let them know that it's okay and that they can seek therapists who are Christian therapists or therapists who just specialize in working with Christians. And there's a lot of therapists who can work with all people, but their belief system are the same. And whether it is or not, and you can find it out, just go to their website, or when you give them a call and ask them that. Find out where they're coming from and what their belief system is and if it works for you.
Yes, I think it's an awesome opportunity for Christians to show love to their own body. People with mental health, sometimes you know they have mental health issues and you don't need to be afraid of them. Encourage them in their strengths, get them involved. And then there's a lot of young moms who are isolated and you don't even know that they're feeling anxiety and depression and all alone. So reach out to people in your church and include them.
Mark, that was a good question, because when I think about it, it's the same thing we say is, what do we do to prevent bullying? It's the same thing. We include everyone. And even if they seem unique or isolated, you don't take it that they're just being isolated and don't want to socialize. Invite them, involve them in, be inclusive of everyone, and ask them, do you need services? Is something going on with you physically, emotionally, and mentally? Because they'll let them know that it is okay for something to be going on with you. It's okay to be depressed and still love the Lord. It's okay to be anxious and still depend on God to answer your services. Doesn't mean that it isn't. So it's letting them know that it is okay. And not that it's more than okay, that it is normal. What's not normal, what's normal about it is how healthy you respond to that. So I think that's important.
It reminds me of how a personal relationship with Jesus Christ changed my life. God wants us to fellowship with each other and provide relationship. That can be very healing. So we need to reach out to people in our church.
Let me ask you this. We talked a little bit about confidentiality. What about the family? What role does a family have in therapy?
Well, that's a great question, and it's a varied answer. I would say I work a lot with children and teenagers. When it comes to children, I like to find out the root of the problem with the child, and then I like to work with the parents on training them to help the kids cope, give them strategies. So I may work separately there, but I never disclose word for word what the child says. There's couples therapy, which is a different kind of confidentiality. I don't keep secrets between couples.
Okay. Carla, you want to add anything to that?
Yes, she said something really good. The best type of therapy is when everyone's on the same team, especially dealing with kids, can figure out what's the family going through and what they're going through and what's going on in their home. She can work with the child also and maintain their privacy so they can trust her, but at the same time, get the picture, the whole picture, because we're all part of a group. And that's the same with adults. And sometimes confidentiality is more difficult when it comes to adults. But it's really great when everyone gets help and when everyone gets treatment and everyone work on themselves and not just say, this is that person's problem and let them work on it. Great. So that's really a good point.
We've talked a lot today. I'm so glad that we have talked about mental health issues. Unfortunately, there are stigmas and discrimination involved with mental health. Can you guys talk a little bit about that and overcoming the stigma and discrimination?
Once again, people with mental health issues sometimes look different. Sometimes they can't control their thoughts or their feelings, and that scares people. So then they get isolated.
Right. And when people look different and act different, sometimes we as a community do not know how to respond. So we separate ourselves and we make them feel more and more isolated. So the solution is to be in community and to talk to people and share your concerns and to learn and grow and just be open and honest. And that's the basic rule for everything.
Well, I'd just like to say that the clients that I tend to see are very progressive and understand the benefits of talking about their problems so that they can move forward. It's a wonderful thing to see people understand that their thoughts and their hopelessness and their anxiety can have healing.
Hey, Jill, if somebody wanted to reach you, want to talk to you, maybe even find out about your practice, how would you recommend they do so?
Well, they can go on my website at www.drjillclark.com, or they can call my office and talk to my office manager, David Clark, at 916-739-1926.
Right. And could you just say that one more time?
916-739-1926.
Wow, it's been so great talking to my friend. We've known each other for a long time and worked together. Please join us again for Couch and Court Issues.
We hope you enjoyed this week's edition of Couch and Court Issues, A Christian Perspective. The information provided by Carla and Mark is not intended to establish a therapist-client or attorney-client relationship. If you have any questions regarding you or your family's legal interests, please call attorney Mark Ambrose at 916-492-9170. This program is sponsored by the law offices of Mark Ambrose.